Today we're going to talk about painkillers. We get this question a lot in clinic. How do they work? When we should take them? When shouldn't we take them? So we thought it would be worth going through this a little bit. Around the body, we have receptors known as nociceptors. These are our pain receptors and are engaged when our body perceives a potential threat or actual tissue damage. So let's take a finger prick, for example. So we have a head of a needle and your finger. When we lightly put the finger on top of there, we feel some slight pressure, but maybe not any pain. The harder we start to push on that needle, the more pain we start to feel, and the more those nociceptors start to become engaged. When we're in pain, the nociceptors send a chemical known as prostaglandin. This circulates through the body, lowers our pain threshold, which means that we perceive the sense of danger as more, and that means that you back off from whatever it is that's causing you pain. So let's take paracetamol, for example, the most common painkiller that we think of. It's suggested that paracetamol decreases the prostaglandin production, and this decreases the amount of pain felt as there's not so many signals traveling to the brain and through the spinal cord to detect pain. So when we take paracetamol, this can mean that we can do more without feeling as much pain, which can be really beneficial during a rehabilitation of an injury. In terms of long-term side effects, we don't know too much about this at the moment in terms of the science. So it's not suggested that we take them for long periods of time, but they can be helpful in a short term, especially at the beginning of a rehab process, so that we can start to do more and get you back quicker.